Have you ever heard of the term chemobrain? And if you have, do you know what it means? I'm Dr. Matt Bridgman. I'm a clinical neuropsychologist. I'm the creator of the Clear Mind Blueprint and founder of Clear Mind Restoration, a coaching program to help people overcome chemobrain. And you've probably seen my ads on Facebook about chemobrain and memory problems after cancer and cancer treatments in reference to that Clear Mind Blueprint. And I've had some comments from people. A lot of people actually have not heard of the term chemobrain before or didn't really know what it means. I even had one gentleman ask me if I came up with the term chemobrain, and no, I cannot take credit for that. But I wanted to do a quick video here to help answer the question, what is chemobrain? And so I'm going to share my screen with you here and show you a bunch of very helpful resources to help you understand and answer the question, what is chemobrain? And the first one is really helpful here to show I did not coin the term myself. It is not my own. Here's an article posted on MD Anderson Cancer Center website. And it states here, in the late 1990s, doctors began to pay attention to chemobrain, a term used by an increasing number of patients to describe mental symptoms and side effects. This is a term coined by patients, not by doctors or providers, not by researchers, but by people experiencing these symptoms. And this is back in the 1990s. That's over 30 years ago. So this has been going on for a while. And this article actually is a conversation with Dr. Jeffrey Weffel, who's also a neuropsychologist, just like me, out of the neuro-oncology service at MD Anderson, and he's the chief of neuropsychology there. And so he starts talking a little bit about what is chemobrain, a term used by patients to describe changes in their thinking or their cognitive skills. Depending on the person, chemobrain might look a little bit different. Could refer to forgetfulness, slower thinking, difficulty concentrating, periods of confusion or fogginess. And so it might be a little bit different from one person to the next. But in general, it has to do with these kinds of thinking or cognitive troubles. That's a little bit there. There's a bunch of other websites, though, a bunch of other organizations and hospital systems that also talk about chemobrain. So here we have a link from the National Cancer Institute that describes chemobrain. Here we see it's a term commonly used to describe thinking and memory problems that a patient with cancer may have before, during, or after cancer treatment. And notice they're not just saying chemo, right? It's called chemobrain, but as you'll see, it can happen even in folks who have not had chemo but have had other treatments. Signs and symptoms of chemobrain include disorganized behavior or thinking, confusion, memory loss, trouble concentrating, paying attention, learning, making decisions, and so on. Look at another one here. This is from the Mayo Clinic. And the Mayo Clinic has a web page devoted to chemobrain. Chemobrain, let's look here. Common term used by cancer survivors to describe thinking and memory problems that can occur during and after cancer treatment. Also might be called chemofog, cancer-related cognitive impairment, or cognitive dysfunction. Well, I'm going to do another video later that talks more about the causes, because that's complicated. Here we're just talking about what is it, what's a basic definition, and what are the symptoms, right? So chemobrain, some of the symptoms that fall into that category, that some people experience some of these and others experience other of these, but overall it might include being disorganized, confusion, trouble concentrating, trouble finding the right word, trouble learning new skills, trouble multitasking, mental fogginess, attention span trouble, short-term memory trouble, taking longer than usual to complete routine tasks, trouble with verbal memory, trouble remembering a conversation, things like that. Let's look at another one. American Cancer Society, they've got a page talking about chemobrain. Sometimes people with cancer worry about, joke about, or become frustrated by what they describe as mental cloudiness or changes they might notice before, during, and after cancer treatment. This cloudiness or mental change is commonly referred to as chemobrain. other names for it too. But again, they go into what are the different symptoms: a decrease in mental sharpness, being unable to remember certain things, trouble finishing tasks, trouble learning new skills, forgetting things that they usually have no trouble remembering, trouble concentrating, trouble remembering details, trouble multitasking, and so on. We're seeing a lot of similarities from one page to the next, right? One source. Here's more from MD Anderson. They've got a formal Chemobrain page. Chemobrain is a symptom. Really, it's a whole collection of symptoms, not a single symptom, reported by many cancer patients with difficulty processing information. Here, look at this. It is a legitimate diagnosable condition that can be caused by chemotherapy treatment, the cancer itself, or secondary medical conditions. Again, I'll have another video where I go into more depth about the causes. And each of these websites actually talks about the causes, but we'll look at those at a later video. But symptoms, MD Anderson says, yep, symptoms of chemobrain: trouble concentrating, short-term memory trouble, feeling mentally slower than usual, and so on, trouble finding words. Here's another one, Cleveland Clinic. They've got a whole page devoted to chemotherapy brain fog, or chemobrain. Happens when coping with cancer or cancer treatment affects your ability to remember and act on information. Usually short term, but some people may have symptoms for months after they've finished treatment. Scroll down. What is this chemobrain? Feeling as if you can't think as quickly and as clearly as you did before you had cancer or received the treatment. Affects cognition. Cognition is how we think, how we remember, our ability to concentrate. This may show up in small ways. Many times people can manage everyday tasks, but feel like those tasks require more concentration and take more time. Yep. Chemotherapy brain fog often affects people's ability to function in the workplace. All right, and one more here. Cedars Sinai, they've got a page, an article here from 2019. What is chemobrain? Going through cancer treatment is physically taxing and can also be mentally taxing. Many cancer patients report collectively symptoms known as cancer-related cognitive impairment, or chemobrain. Yeah, this is an important quote here. And again, we'll talk more about this later, but chemobrain is actually not a great term for this. I have many patients who are struggling with these symptoms who've never had chemo. And actually, I have a whole other video I already did, which you might have seen already, about CONS, cancer ordeal, neuropsychological symptoms. And I talk about that. Chemobrain has been a very, very important term over the years to bring people's attention to the reality of this big problem. But it is a number of other people have written about the limitations of the term chemobrain, but we still use it. I still use it. Sort of mental fog that affects patients' overall cognitive function. Symptoms are subtle and often go unnoticed by loved ones. Subtle is a tricky word because, I mean, in the grand scheme of things, yeah, it's not as bad as dementia or a stroke. But it's not necessarily mild. If you're the one experiencing it, it can cause very big problems for work and life. And yeah, people around you might not notice it, but you're definitely feeling it. Mild forgetfulness, word finding trouble, trouble remembering dates, and so on, trouble concentrating. This is Dr. Arish Asher. You see his picture down there, physical medicine and rehab doctor at the Cancer Rehab and Survivorship Clinic. He's the director of that at Cedars Sinai. And he says, yep, chemobrain is extremely common. As many as 75% of cancer patients have experienced it during their treatment. About a third of patients may continue to struggle after treatment. For most patients, effects resolve 6 to 9 months, but for others, the symptoms could last years. And that's consistent with what I've noticed with all the people that I've talked to. So a lot of hospital systems, some big, reliable people and organizations are saying, yep, chemobrain is real. And this is not new. Actually, there's some research articles dating back into the late 70s. It's over 40 years ago, where people were starting to talk about cognitive symptoms related to cancer and cancer treatments. Finally, in the 90s, the patients got so tired of not being heard that they termed it, gave it a name, Chemobrain. And thankfully, lots more research has been done over the years to the point where finally we've got all these hospital systems and others devoting, pages on their websites to talk about this Chemobrain and the symptoms and the causes. This is a very, very good article that I found. There's lots of good articles on this, but this is a useful one, a really good one. Cellular mechanisms and treatments for Chemobrain, insight from aging and neurodegenerative diseases. So there's a lot in this article. I'm not going to go through the whole thing, and maybe in future videos we'll talk more about it. But right now I just want to highlight one, the authors, and I'm very sorry, I'm probably going to mispronounce her name. And if someone wants to correct me, I'd be happy to learn the correct pronunciation. But Lynn Nguyen and Dr. Barbara Ehrlich. And if we look and find out about these two women, they're from Yale University, and I've actually pulled up their web pages here. So these two individuals are from Yale. Lynn is a graduate student, and she's studying a neuronal calcium sensor, the role of that in paclitaxel toxicity. So this is a chemotherapy, and she's studying how it affects calcium and some other things at a very cellular level, stuff that's above my head. But she is studying how it affects the brain and the central nervous system. And this, I assume, is her advisor, supervisor, Dr. Ehrlich, professor of pharmacology and cellular and molecular physiology at Yale. The smart woman, doing stuff that's well beyond what I can understand. But at the basic level, I realize, okay, there's some very, very intelligent people at a very high level. I'm sorry, that's my puppy there having a drink. You can hear the water. Very intelligent people studying the effects of cancer treatments on the brain and the central nervous system at a very, very detailed and high level. And so they wrote this wonderful article here. And just a couple things. Actually, I'm going to pull up the PDF version of it here because I've got a few things highlighted. And so just the first line here: chemotherapy is a life-saving treatment for cancer patients, but also causes long-term cognitive impairment or chemobrain in survivors. Look, 1978, concerns were raised about the impacts of chemotherapy on the emotional and cognitive status of cancer patients and how they were severely underreported by clinicians and patients. Here we look a little further. Cognitive complaints are common among cancer patients during and after chemotherapy, talking about short-term memory trouble, working memory, verbal ability like language and word finding, executive trouble, attention span trouble. There's a lot of good stuff in this article. These deficits, these cognitive troubles tend to be subtle. Again, that's, it doesn't feel subtle if you're going through it, but compared to dementia or stroke. But again, we talk about, some kind of trouble like a stroke causes symptoms. You have symptoms with dementia. It's not, is my brain fine, or I have severe problems. There's this big gradient of how well is my brain performing, how well is my memory and my mind performing. And this might be when my mind and my memory were sharpest. And here might be, dementia, where I'm so bad I can't manage my own finances or medication even. But we've got all these levels of how well is my brain performing in there. And so, when they say subtle, they're talking about, oh, well, there's been an obvious and measurable decline in how well my mind is performing, my memory, my attention. It's not at the level of dementia, but it's also not normal, right? And so at this level, well, some people might still be able to work, but they're having to work a whole lot harder. Their mind's having to work a whole lot harder. That might be taking them a lot longer. They're spending more hours at work in order to get the work done. They're kind of just kind of struggling to keep their head above water, working so hard, leaving them exhausted. So they are real problems. But they say here, these deficits tend to be subtle, such that cancer survivors with chemobrain perform at lower end of the normal range. So it is a change for them, but not yet in the pathological range, which, I mean, that might be the wording they use. That wording is kind of debatable, because if you say, well, if it's not yet in the pathological range, does that mean it's not a problem? And I would argue, oh, it definitely is a problem. It definitely is an abnormality for that individual person. You can take someone who performs average and normal level, and then they've dropped to the low average or low normal level. Well, yeah, they're not technically impaired, maybe, but it's definitely a change for them that might be causing real problems for them in life. This subtlety, together with the reliance on tests tests that are designed to detect more severe problems, because of these things, these changes are often undetected or underestimated by clinicians. And this is part of the problem of why the symptoms were maybe first noticed and questioned in the 70s and not really started to get more attention until the 90s. And then it's not until the 2000s that people start better understanding the physiology and the biology underneath, and better measuring and understanding these symptoms, why it's taken so long. And yet still, even now, even 40 years later, there's still so many people and providers, healthcare providers, doctors, even within cancer fields that don't fully get it, that don't fully understand this chemobrain. Just a couple other things real quickly before I finish up. So these studies, so that the authors here described a variety of other very important studies, but ultimately the bottom line here, these studies provide concrete evidence that the symptoms of chemobrain have biological basis rather than being purely psychological. So these symptoms, this chemobrain, these memory problems, people who are having these troubles, they're not making it up. They're not lazy. It's not just stress. It's not just depression. It's not just fatigue. It's not just getting enough sleep. It's a lot more complicated than that. These are very real problems and real changes with how their brain is capable of performing. And so chemobrain is a real thing. It's a real thing. So I hope you find this helpful. And I'll have the links to these different sites that I showed you down in the chat or down below the video here for you to check out at your leisure. And then keep an eye on my channel here, because I hope to post a number of other videos, maybe going into more of the causes of these chemobrain symptoms and the treatment options. So thanks.